Hey, my name is Reed.
Hey, I'm Lofton.
I was wondering if you could tell me what naloxone is and how it works.
Absolutely, I'm really glad you asked. Naloxone or Narcan, naloxone is the generic name, Narcan is the brand name, is an opioid antagonist. So it was developed in 1971 and has been used in emergency rooms and ambulances for decades as the standard treatment for suspected opioid overdose. And over the past couple of decades, there's been a movement to pass laws in different states across the U.S. that expand access to naloxone for regular people. So people who are not doctors or paramedics, regular people like you and me, can have access to naloxone and can use it in an emergency. And basically, all naloxone does is it attaches to the same receptors in your brain that opioids attach to. So if somebody has too many opioids in their system and they're having an opioid overdose, the naloxone gets in there and it temporarily knocks all the opioids off of those brain receptors and it covers the brain receptors. So it reverses the process of respiratory depression in an opioid overdose and allows the person to breathe again. It's a really safe medicine, that's all it does. So if you give it to somebody who is not experiencing an opioid overdose, nothing will happen.
Okay. How do you know someone is overdosing?
Great question. So for an opioid overdose, and so opioids are heroin, fentanyl, prescription opiates like Percocet, Oxycontin, Dilaudid, morphine, methadone. Those are all opioids. They all work on our brain receptors the same way. So basically, what the opioids do is they attach to the brain receptors, they give us pain relief, they give us euphoria, but if we have too many opioids attaching to the brain receptors, those are the same receptors that control our breathing. So basically, they kind of trick your brain into thinking you don't have to breathe. So your breathing slows and then stops. So that's what kills a person in an opioid overdose, is not being able to breathe. So what that might look like is the person, their skin, particularly around their mouth or their fingernail beds, might start to turn bluish or grayish, depending on the person's skin tone. Their skin might feel cold or clammy to the touch. They might vomit, they might not. A lot of times people will hear kind of almost a snoring sound, like a gasping, gurgling sound. It's called agonal breathing. So these are all just signs that the person is struggling to breathe and they're not getting enough air. And sometimes you might not notice any of these visible signs. The person might just look like they're sleeping or they're nodding off.
Okay. What are some of the risk factors for overdosing?
Good question. So anytime, obviously, you're using opioids, there's a possibility of overdosing, but there's some things that really increase that risk. If you're somebody who uses opioids every day and you've developed a tolerance to them, if you stop using long enough to get sick, then if you start using again, your body has lost that tolerance. It loses the tolerance really quickly. So that means that something that was a regular amount for you to use when you had a tolerance can be lethal if you don't have a tolerance. So sometimes that people lose their tolerance might be if they've been to jail or prison, if they've gone to detox, if they've taken a break from using for any reason. Anytime you've been using for a while and then stop and then start using again, you're at risk for overdose, because something that your body could handle before can be too much for it when you don't have a tolerance. Another big risk factor is mixing. Anytime you're using more than one drug at the same time, it increases your risk of overdose. So that's true whether you're using an opioid and another downer like alcohol or benzos, and it's also true if you're using an opioid and something else that's an upper, like a stimulant like cocaine. The drugs have synergistic effects, so they're sort of multiplying together. So it's not like 1 and 1 is 2, it's more like 1 and 1 is 4 or even 5 or 6. So anytime you're using more than one drug at the same time, it increases your risk of overdose. And then obviously if you're using alone, that doesn't change your risk of overdose, but it changes your risk of survival because there's nobody there to help you.
Right. Can you show me how to use Narcan and show me how to get into the recovery position?
Absolutely, I'd be glad to. If you're with somebody and you're worried that they might be overdosing, the first thing you want to do is see if they're able to respond. So take your knuckles and rub on their sternum bone right here. So if you do it lightly, it doesn't feel good. If you do as hard as you can, it really hurts a whole lot. But it's not going to injure the person. So if they're not responding to the sternum rub, that's when I know I want to go ahead and give naloxone and do rescue breaths. So you have an intramuscular kit that typically looks like this. You have 2 bottles in the kit. 1 bottle is 1 dose, so you don't have to measure it. I'm just going to draw all the liquid that's in there. You pop the orange cap off. There's a gray seal underneath. Put the bottle down somewhere steady, like the floor of the table. You have 2 big intramuscular syringes in your kit. You want to grab one, take it out of the packaging, take the cap off, insert the tip of the needle through the seal, flip the whole thing upside down so you can use the plunger to draw back all the liquid that's in the bottle into the barrel. And because I'm going to inject it in Reed's muscle, not their vein, if I drop a little bit of air as well, that's okay. It's not going to hurt Reed. Just focus on getting as much of the liquid as I can into the barrel of the syringe. Then I'm going to inject it into a big muscle. So I could go upper arm, thigh, or butt. The needle in the kit is like an inch, inch and a half long, so I could go straight through Reed's t-shirt or jeans if I needed to, and I would still hit the muscle okay. It takes the naloxone a couple minutes to get to the brain receptors, so I'm going to give him that first dose, wait a few minutes to see if it starts to work. If there's no response after 2 or 3 minutes, I have a second bottle and a second syringe. I'll go ahead and give that dose. Same with the nasal. You have the 2 sprays in the kit. Just take it out. Insert the tip of the nozzle up the person's nostril, press the plunger, spray all that liquid up one nostril. In the meantime, while I'm waiting, I want to assess the breathing situation and see whether Reed is breathing. So if Reed's not breathing at all, or they're breathing very slowly, like less than 1 breath every 5 seconds, I need to give rescue breaths to get him through until the naloxone starts to kick in. So I want to make sure their mouth is empty, so I can just take a few fingers, swipe through to make sure there's nothing in there, like food or gum that they could inhale. Then I'm going to use one hand to tilt their chin up, and that just clears out the path that the air is going through. Other hand to pinch their nose closed, and I'm going to put my mouth over their mouth, give them a slow breath, breathe for myself, give them another slow breath, breathe for myself. And while I'm breathing, I can look down and make sure that I see their chest rising, and that tells me the air is getting where it needs to go. So not into their stomach, but into their lungs. And then if I have to leave Reed alone at any point in this process, I want to go grab my naloxone kit or my phone, or anything from the other room. I want to make sure and put Reed in the recovery position, so that way if they vomit, they're not going to inhale the vomit and choke on it. So that just means rolling on the side. So I'm going to bring this knee up, and that just kind of braces Reed in this position. Have this one arm up so that Reed's head is resting on it, and the mouth is facing down. And that way if Reed vomits, the vomit just drains out and doesn't get inhaled.